السلام عليكم. بهذا الفيديو إن شاء الله راح أشرح لكم الجزء الثاني من محاضرة Application of Laser in Cosmetic Dentistry. In this part I will talk about frenectomy, bleaching and type of laser used in this procedure. Also I will talk about removing of the veneer by laser. First of all I will talk about frenectomy. As we know, frenum is the mucous fold that connect lip, cheek to the attached gingiva, alveolar mucosa, also periosteum. So when for any causes or for any reason that this frenum, its attachment is high and cause diastema between the teeth as seen in this picture, we need to remove the frenum. So the frenectomy meaning complete removal of the frenum including its attachment to the underlying bone. This is the conventional surgical technique. Conventional surgical technique, as seen in this picture, this is the labial frenectomy. In the conventional technique, we need anesthesia. After injecting of the anesthesia, make an incision by the surgical blade. Also, you can hold this frenum by the hemostat and then cutting with the blade, then suturing. Also, this is the lingual frenectomy. As we know, the lingual frenum is the fold, mucous fold, connect or extend from the floor of the mouth to the middle third of the tongue. When this frenum restricts the movement of the tongue, this is called tongue tie. This is the congenital abnormality, tongue tie or ankyloglossia. So lingual frenectomy is to treat this condition. Tongue tie, this is thick, short lingual frenum restricts the movement of the tongue. So we remove it by the process or by the surgical procedure that's called lingual frenectomy. In the lingual frenectomy, after injecting anesthesia and hold the frenum with hemostat, then cutting with the surgical blade, and then suturing. This is the conventional technique, need suture, need anesthesia, painful when compare it by using of the laser. Type of the laser that used in frenectomy. All the type of the laser can be used in the frenectomy. CO2 and neodymium laser are less post-operative pain and less complication than the scalpel technique. Also, the depth of the penetration of diode and neodymium yak when compare it with erbium is more than the erbium group laser and CO2. So, all type of laser can be used in this surgical procedure. In this slide, I will show you different cases of the frenectomy with different type of laser. This is the labial frenectomy by diode laser. As seen here, this is more comfort to the patient without use anesthesia. Also, without suturing, dry field, more comfort to the patient, painless area, painless surgical procedure. This is with diode laser. Also, this is the labial frenectomy, this case by Dr. Asil in a Shahid Nawar Musa Dental Center. This is by erbium group laser. As seen in this picture, dry area, without need anesthesia, with more comfort to the patient, and no need of suturing. This is such a really nice case. This is immediately post-operatively. Also, this is the labial frenectomy by Dr. Asil Yusuf. More comfort to the patient. Painless surgical procedure. Dry area. This is frenectomy by diode laser. Provide more dry field. This is the coagulation. Predictable healing. More comfort to the patient. Also, this is the labial frenectomy by erbium chromium laser. This is by Dr. Asil Yusuf. 3 days after surgical procedure. We see predictable healing, faster than the conventional technique. This is by CO2 laser. Also by Dr. Asil, this is by CO2 laser, labial frenectomy. We see this dry area. More comfort to the patient. This is lingual frenectomy by erbium group laser or erbium yak laser. We see without need anesthesia or suturing. And predictable healing as seen in this picture. Then I will talk about bleaching. Bleaching became an important part in cosmetic dentistry. It is the cosmetic therapy, meaning lightening the color of the tooth by application of chemical agent to oxidize the organic pigmentation in the tooth. Meaning lightening the color of the tooth to remove the effect of the food particle or tobacco or tea, coffee, to improve the color of the teeth. So it is the cosmetic therapy by application of the oxidizing agent. Oxidizing agent, most commonly used oxidizing agent is hydrogen peroxide 35%. In this picture, I will show you how bleaching process occur. Bleaching process needing bleaching gel and activation of this gel by light. This is the conventional light. Bleaching gel that contain the oxidizing agent, 35% of hydrogen peroxide. This acts on the crystal in the enamel. Also, this acts on the organic material of the dentine, convert the color organic material to the colorless to improve the color of the tooth. And this gel need to be activated by light. This is the process of bleaching. In this picture, I will show you the difference between conventional bleaching technique and using of laser. The most important point in bleaching to reduce the post-operative pain or post-operative sensitivity. All technique attempt to reach or to reduce this post-operative sensitivity. This is by two reactions. We must know two reactions, photochemical and photothermal. Photothermal, this is mostly occur in the conventional bleaching process by conventional light. Photothermal, as seen in this picture, this is the photothermal reaction. Photothermal reaction, meaning that the light, conventional light, not only acting on the gel, but can separate heat through tooth structure, and this would increase the incidence of postoperative sensitivity. This is called photothermal. Separate the temperature or the heat through the tooth structure. Photochemical reaction. We prefer photochemical than photothermal. Photochemical that occur mostly with the laser light in the bleaching process. Photochemical, as seen in this picture, photochemical, light only acting on the gel, not separate the heat through tooth structure, and this reduces the postoperative sensitivity. So we prefer when using the bleaching process, we prefer to do photochemical, not photothermal. This is the difference between conventional light and laser light in the bleaching process. Type of the laser used in bleaching. Previously they use argon laser, KTP laser, but now they not use these type of laser. Mostly used today, erbium laser, diode laser, and CO2 can be also used. Most commonly diode laser and erbium group laser. Erbium group have advantage. Erbium group heat the gel. Their reaction is photochemical, not photothermal. But diode has this advantage because of their high depth of penetration. Their reaction not photochemical, but photothermal. can separate heat through tooth structure. So diode heat all the teeth or all the tooth structure. Increase the incidence of postoperative sensitivity when compare it with laser group erbium group laser. This is the difference between erbium and diode laser. As seen in this picture, this is the difference between erbium and diode laser. This is the erbium acting on the gel only. Its reaction is photochemical. But diode, due to the high depth of penetration, act on all the tooth structure, meaning their reaction is photothermal. This is the difference between these two types of laser. Diode laser, as we know, the wavelength of diode laser 810 and 830 nanometer. In order to decrease its thermal effect in the bleaching process, it should be used at minimal power as possible. This is the bleaching by diode laser. This is by diode laser. Erbium laser, not penetrate through the gel, only acting to the gel. This is picture show the bleaching process by erbium laser. This is by erbium laser. We must remember to cover the gum by gum barrier to prevent postoperative sensitivity to the gum tissue, as seen in this picture. This is irritation of gum tissue because improper use of the gum barrier, not using gum barrier in this area. To prevent this irritation, we must use gum barrier to prevent this irritation in the bleaching process. At the end of this subject of this bleaching, most problem of the bleaching occur with reduce the clinical experience. So it is important to reach successful result. To reach successful result, hand-on training, clinical experience with theoretical knowledge. All these should be followed to reach successful bleaching process. Most commonly used today, biolaser. Biolaser, this is the diode laser, but diode laser in the wavelength 940. This is 940. This diode laser depth of penetration is less than the conventional laser. This diode laser water absorption, less depth of penetration. Biolaser is most commonly used today because it also reduces the time of application. As we know, the conventional time is 30 minutes. This type of laser provide or reduce the time of application. Time of application of this type of laser only 30 seconds in each quadrant. So this reduces the time of application. And also their reaction is photochemical, not than the conventional diode photothermal. Photochemical, acting on the gel only, reduce the time of the application, and all this led to reduce the post-operative sensitivity. So it's very effective and mostly commonly used today, biolaser. Then I will talk about removing of the veneer by laser. As we know, veneer is the thin layer of tooth-colored material, used mostly in the cosmetic therapy to improve the appearance of the tooth. Studies show that the erbium group laser is most effective in removing this veneer than the conventional technique. Reduce the fracture of the tooth, reduce the time of removing this layer of veneer, especially erbium group laser. Erbium group laser, they are acting on the bonding agent. Their wavelength absorbed by the bonding agent that connect between this veneer and tooth structure. So laser absorbed by this bonding agent and cause debonding. There is also reduce the time. Only 30 seconds can remove this veneer by using erbium group laser. I will show you this video.
So just when I start, tell me when I've got to 30 seconds. 30 hertz, 175 millijoules. Yeah, make it crack.
5 seconds. 30.
That was 30. Let's just see if it will come off or not. Maybe I have to do a little bit more. Seconds.
As seen in this video, it is easy process, removing of the veneer, very easy, with less time, only 30 seconds, without any complication or any tooth fracture. At the end of this lecture, the accessibility of the treatment by using laser depends mainly on the dentist, how to manipulate the power of the laser, and also how to reduce the time of application as possible. It is the best therapy for those patients, especially anxious patients, for seeking more comfort treatment during the surgical procedure. It provides dry field, increase accessibility, provide predictable healing when compared it with conventional technique, and also have the ability to kill the bacteria, and this reduces the post-operative swelling and post-operative pain or any other complication. So it is most effective treatment and become a most important part in cosmetic therapy. لهنا خلصت محاضرتنا، أتمنى استفادتوا منها بالقدر الكافي، وألقاكم إن شاء الله في مواضيع أخرى في مجال طب الأسنان. أتمنى استفادتوا من هذه المحاضرة، أصبحت جزء رئيسي في مجال طب الأسنان. شكرا لاستماعكم.